We're good.
All right, I'll call this meeting to order with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, first up, approval of the minutes of the regular board meeting of December 14th, 2020.
Move to approve.
Second.
It has been properly moved and seconded to approve the minutes from December 14th, 2020. All those in favor signify by saying aye.
Aye.
All those opposed, motion passes. Next, approval of general fund vouchers 78272 through 78333 and wire transfers 202-10266 through 202-10299.
Move to approve.
Second.
It has been properly moved and seconded to approve the general fund vouchers and wire transfers. All those in favor signify by saying aye.
Aye.
All opposed, motion passes. Public comments on the agenda. I think there was anything over there. Next, new business, item A, review of COVID-19 response.
Wait for Mr. French to come on in. Oh, gotcha. Okay. All right, well, I guess I'll start with just kind of where we're at numbers wise. Right now, currently in the district, we have 4 individuals, staff members that have tested positive, and 1 current student that has tested positive. I changed the letter a little bit. It's in there. Overall, from when the year started, we have 27 students that have tested positive, and then 22 staff members that have tested positive. So we met as an admin team on Monday and started the conversation of how things were really going well, and that our numbers remain low. Our student numbers continue to remain low. The issue is really the staffing, and sharing a little bit as you guys were coming in. The staffing numbers are low, but the stress level is still kind of creeping in that higher level just because of the other surrounding districts around us. It's had an impact on our sub pool, which means we have less subs in the district. So Monday, like I said, we met as an admin team. We were talking about the different things that we could start to open up, within the parameters of the restrictions and guidelines, and we're talking through that. And then Tuesday hit, and then we had 4 staff members that tested positive. So kind of put the brakes on that a little bit. We're still in that mode that we want to continue to look for ways that we can start opening things up, I guess, for lack of better terms, but just really continue to try to make this year resemble a normal year for our students. It was, the conversation on Monday, and we're going to continue to do that. So I'm still hopeful that we will, be able to start, looking at the different things that we have in place and putting things in place for the kids. But I also do want to be careful because it really, the sub pool, the population of subs that we have in the district, or just like I said, with the surrounding schools opening up, it shrinks our pool quite a bit. So that's where we're at as far as the numbers go. Youth sports guidelines, I have in there. I included for you guys. We're trying to get that going as well. It really, if you look through the guidelines, I don't want it to sound like it's deceiving or anything like that, but it really resembles more of like what we're doing in gym class. We don't want to go outside of the guidelines as far as what we have. We're not going to allow the sports teams to only practice without contact. We're still having them cohort, so it's really going to, like I said, resemble what's going on in the gym class. They're not allowed to do any competing of sports. All of the majority of the Polk County schools are doing the exact same thing that we are. There's a couple, minor things that look a little different, but so that's in there. Just wanted to share that with you guys for you to look through in case there were any parents that had questions or conversations that you had with parents. So that was the main thing. Then I included you guys on the email, all staff email. The Polk County Health Department reached out. They're looking at rolling out the vaccination process. So they're collaborating with the Amory Clinic, and the Phase 1A, they're calling it, is the healthcare workers, and then individuals in the district like nurses and health aides. Now, we don't have a nurse, but we have some secretarial staff that function, in that health aid capacity at both buildings. So those individuals qualified, and then if they wanted to participate, they could sign up, and then I sent their name over to the county, and then they would get vaccinated. Round 2 is called Phase 1B. That's considered all essential workers, and then anybody within the school district capacity, any teachers, support staff, all areas of education, coaches, board members, anybody that has anything to do with the school district would qualify in Phase 1B. So I'll be sending a survey out to everybody to try to get names to identify who wants to participate in the COVID-19 vaccination. They're saying that the tentative timeline is for sometime in February, is what they've shared with me. They're doing the Pfizer and the Moderna are the 2 vaccines. I'm not sure which one, and I'm not sure if they know yet. It sounds like it's a pretty quick turnaround. They just said that individuals have to be ready once you're identified, and once you identify yourself as participating, and then you set up an appointment, and you have to be ready to go into the clinic to get that shot fairly quick. Any questions with that? Not that I'm not even sure if I would have answers, but if you do have questions, I can try. It's pretty limited information, but they're trying to roll it out. Like I said, the county and the clinic together are doing that. No? Okay. Any questions with the youth sports? No? Okay. That's really it as far as the the COVID-19 response. I do want to say one other thing though, with the when we met as an admin team, one positive note is we haven't talked at all about initially we were talking about, do we move to a 4-day schedule? We haven't even had to reconvene the steering committee for the pandemic steering committee, because things have been going really well as far as numbers and our cases, so that's been a positive. But like I said, we were just starting to entertain the conversation of some of our co-curriculars, and then even within the building what we're doing with stuff, and then Tuesday we ended up getting a couple of people that tested positive. So thankfully, the silver lining and all that is everybody that has tested positive have had just flu-like symptoms, some more significant than others, but nobody, extreme health cases where, fearing for their life or anything like that. So it's just been more flu-like symptoms. And then student-wise, we really have had very limited number of students that have tested positive. So that's all I have for the update on the COVID-19, unless you guys have any questions.
So if we were going to have a way from the Christmas get-togethers, that would be presenting its head right now, or already with these first?
Say that again?
If the COVID-19 will be rearing its head from the get-togethers at Christmas, that would have happened already, right?
I believe so. What I've been told by from the county is it goes in. They predict 2-week increments. 2 weeks people testing positive, 2 weeks people getting sick, 2 weeks then death is kind of the timeline that they've communicated to me as far as the testing positive, the flu-like symptoms, and then if people end up dying from it, it's a 2-week window. So. Yeah, I mean, when we were in after the Thanksgiving break, I was anticipating, a lot. I thought, having seen the Thanksgiving break and then leading into the Christmas break, I was expecting a lot more numbers this week, and we haven't. Like it's been really. I think we've been doing really, really well. And thankfully, not, like I said, not many people with severe illnesses. So.
Right on.
Anything else?
All right, you guys want to move on to the consideration and approval of extending the FFCRA leave?
Okay, so I put that document in here for you. It's right after the youth sports guidelines. So in the board docs that I gave you guys, I gave you the form that we've been using in the district, and then explained it a little bit. So the FFCRA is the Family First Coronavirus Response Act. That language gave small businesses, our school district fell into that category, where it gave individuals paid leave. And there are a couple different categories of paid leave, but kind of a generic version of it is everyone was allotted 10 paid leave days tied to the COVID-19. So they did not extend that. We were waiting to hear, whether that would be extended or not. On December 31st, it expired, and then President Trump signed into law that it wouldn't be extended, but that it gave small businesses and school districts the ability to continue with it, but obviously it's at the expense of the district. And in all reality, it was at the expense of the district before too. I mean, we had spent our CARES. It fell under the CARES Act money, but we had, with all the different expenses that we had already utilized that money. So I gave you this document. This shares how many individuals that we've had in the district that have utilized this, the cost of the district, what it's been. So everybody in green, if you see anybody in green, like that first employer, that first individual listed, they've used their 10 days up, whether they tested positive or they had symptoms. So total, we've had 265 days that were used by staff due to COVID, that have had to be on leave. Either they had symptoms and they were out for a day or two until they got their test results back, or they were out because they tested positive, or they had a child that was out sick, or they were caring for someone in their household that tested positive. They were quarantined or excluded in any way due to COVID-19. So with that, then the total sub cost, you can just see on the second page is in my handwriting. We've spent $13,903 as of December 31st. On the first page, we currently have 6 staff that have been excluded, and then 4 staff that have tested positive in the time frame from the December 31st to now. So this is the language that I'm proposing, that we're proposing as a district to you guys, for you guys to talk through and look through. It's not exactly what the FFCRA language was prior, but under the kind of the bulleted items gives you the breakdown of what would qualify and what wouldn't. So my opinion is we're still excluding staff members, so I feel like we have to do something. We can't, remove individuals from the building, say you can't work, and then at least my opinion is that and then not pay them if we're the ones, not us as a district, but because of the exclusion criteria that has been imposed upon us, that we have individuals that are out. So with that said, what would be covered under the emergency paid leave extension that we would extend in the district would be any employees exhibiting COVID-19 symptoms. So part of that those symptom criteria is deemed by the exclusion criteria, so that way if that does change or the county changes it, it would still fall under that. Employees who test positive for COVID-19 and use the PCR test to get tested. Employees that identified as a close contact and required to quarantine due to contact tracing in the Clear Lake School District. So that's one little bit of a change, where if they're identified as a close contact outside of the district because of their own situation, that wouldn't qualify. But if it's a close contact within the district, if we're the ones doing the contact tracing saying that they have to be excluded, then they would qualify. As long as they, this does not apply if it is determined the employee was not appropriately physical distancing, or if they failed to comply with the district PPE requirement. Things that would not be covered under the emergency paid sick leave, COVID-19 related quarantine from contact tracing outside the district, outside of the Clear Lake district, caring for a child due to school closure or daycare, COVID-19 related closures. Employees may be eligible for FMLA and available leave may be used, so they can still use their own leave, but then they would have, like I said, they would have to use their own leave. So this would be. So what you guys have to decide is, 1, do we want to do something like this? 2, is this the language you guys want to use, or do you want to discuss using something else? And then 3, if yes, if this is what we want to do as a district, right now, do we retroactively those individuals that have been excluded from December 31st till now, does it retroactively go in effect? So do those individuals still qualify? So thoughts on any of that? I feel like I'm talking a mile a minute. I apologize.
I'd say yes, yes, and yes.
I have a question.
Yep.
Can I ask? How are you going to identify whether it's a in-school contact or an out-of-school contact?
Just my question.
If they're a close contact because of what we, that one will be pretty easy, because if it's a close contact that we deem as a close contact because someone tests positive or something happens in the district, then they would be deemed as a close contact. But if we get a call from the county saying, so-and-so was deemed as a close contact, he was at the whatever, so that would, I mean, if you guys don't want to go down that road, we'd have to change the language with that too.
Do we have a lie detector test in the building?
Well, that would be easy because we would be doing the contact tracing. So if it's not us doing the tracing and
Then it'd
saying
just be
you're
people.
excluded, everybody else is not covered.
Correct.
So that's pretty straightforward how to determine that line.
Determining it is easy, yeah. It's whether or not it's, what you guys want to do is obviously a different conversation. But if you feel like everyone should be, regardless of where the contact tracing took place, or regardless of what individuals choose to do or where they choose to be, if they are deemed as close contacts because of that, then we would open it up again to everybody. But if it's internally,
I like the language. I think that, a little bit of the responsibility should be bared by the staff. What do you guys think? And as far as being retroactive, I think that's kind of, should be.
I agree with you. I think to those
So
individuals.
was there a question with the contact tracing of the retroactive ones, or was it all from school?
6 that are excluded, is it from our contact tracing?
Or,
2, 1 was, but they tested positive, so they would still qualify. No, I think all 6 would qualify, to be honest. Because if they're symptomatic, then they automatically qualify. It's just a non-symptom and identified as a close contact was the one difference.
Right.
so yeah, I'm good with that as well.
Okay. And then the rationale behind if they are deemed a close contact outside of the district, but then they end up testing positive, my opinion would be that they would still qualify after they test positive, because it'd be pretty tough to determine.
Sure.
You could probably best guess where they contracted it, but having worked with the attorneys this summer on it, it's pretty much impossible to identify how or where an individual were to test positive.
Do you need a motion or anything for that?
This will need a motion. So retroactive, so we change it, the dates would be January 1 to March 31st. And then we would, based on kind of all the different moving parts now, I can't remember if I said, would we bring it up on a monthly basis, or if it would just be as needed. But I can figure that out.
So the
then.
maximum would be 10 days.
Yeah,
That's
so
all you
maximum would be 10 days. If individuals already used their 10 days, then they would not, they would have no more days. So that's something that, if you guys want to discuss that as well.
I think my only other issue is I'm not sure you can or should have a leave act that has a clause about following PPE and policy. Those are 2 separate things. Like even workers' comp, it doesn't matter if you didn't follow policy, you pay, and then the disciplinary is a secondary issue. They're separate, not together.
And I believe we can with this, because they'd be identified as a close contact, because if they had their mask off and weren't weren't utilizing their mask and then they just identified themselves or somebody identified them as a close contact. I think in my opinion would be both. Could be disciplinary in nature.
Because I would think it's more disciplinary in nature than a compensation piece, because it could be hard to prove.
Well, the PPE, close contact, not necessarily testing. If they test positive, that's different.
That's not the issue. It's the PPE, because you'd have to prove they didn't have the PPE, and you'd have to prove that they didn't physically distance.
Right, but the proving of the PPE would be taking their word for it. So when you get identified as a close contact, we have to ask the questions. Were you in? Did you have your mask on? Were you in, within the proximity of 6 feet for 15 minutes? If they fell in the 15-minute criteria, there's nothing inappropriate about that. They would just be. But if they were next to someone without their mask on, then they said, "Yep, I had my mask off." Well, then they weren't abiding by the PPE expectation. So then they would qualify as. Then they wouldn't qualify for the paid leave. Does that make sense?
It makes sense. I just don't know that I agree with it. It makes sense.
And feel free to discuss if you guys want.
Well, I don't, I guess we probably don't have a lie detector test, but if you're gonna take people's word for it, that might just be kinda,
Yeah.
all it basically is showing, hey, you guys kinda be responsible. If you're not gonna be, an instance where one of the staff members is hanging out downtown in close proximity at the Midway Bar, and they, for some reason, they contract. We don't need to pay for their leave. You're
Right.
acting irresponsibly, so it leaves us an avenue to take, in such a case. So
Yeah, and a lot of the close contact right now is like, we even internally admin and even the offices, we take everybody at their word. What they're telling us, we have to, that's what we're following. Were you close to this person, yes or no? Then they identify themselves, and most are saying no. And like you said, we're not carrying around a lie detector. I'm not. It is what it is. We're asking people to be professional and honest. So.
Are we having an issue with staff not following PPE guidelines and policies?
No.
Okay.
No.
Then that would make a point as well for not having an issue.
Well, then I'll entertain it, unless somebody's got anything else they want to add.
So I think the biggest thing that's gonna be different is just the child and family stuff. Because it's pretty much the same for them, but they're not gonna be covered for anything happening with their kids anymore. Is
Right.
that- Yeah.
Correct.
And you're asking Eddie if that's okay?
I mean, I think that's hard because the situation really hasn't changed in our community. But at the same time, we were doing it because it was the FCC Act.
Yeah.
I think that's hard still.
And if you guys want that language in there, the FFCRA was 2/3 pay. I would recommend if you guys want to explore that, or if you want to talk through that, then I would recommend doing the same thing that the FFCRA was with. If you have a child that's out and you choose to be out, you've exhausted your 10 days, then it would be 2/3 of your compensation. It wasn't 100. That was the one area that wasn't 100% of compensation.
But staff have sick time too. If their child is out sick, are they able to use their sick time for that time as well, or is sick time only for them?
I was trying to see where we
They could use sick time for that as well.
Okay,
Yeah.
so there is a compensation option.
Yeah. Yep.
They can take sick time then.
Yeah. So, and as you can see, so we've had, like in the district, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 of our 100 employees that have used all of those 10 days. So there's 90 staff members that haven't used those 10 days.
Nanny, I think you bring up a good point. I guess I'd be for continuing the 2/3 pay from a child or a family member they have to care for. What do you guys
I don't know, if you have sick pay, you get 100% of your pay.
Yeah.
Versus 2/3.
You would
Another
Would you rather
option.
take the sick pay?
Another option that we could do is just scrap the 2/3 pay and just say doesn't, that qualifies as part of these 10 days is childcare as well. So not above and beyond these 10 days with the 2/3 pay. If you guys want that as part of the criteria, we could say that the child, caring for a child due to school, daycare, COVID-related closures, kind of that second bullet in the not covered, we could just shift that to the top section is covered, and that would fall just under the 10-day criteria. If they haven't used that and they have
And they don't get 10 days for them and 10 days for their
no,
kids.
it's
10
just
days
10 days.
total.
Yep. Or in the FFCRA language, you get 10 days and then 10 weeks for childcare, outside of that 10. So a total of 12 weeks of paid leave.
I guess I would lean towards that, saying the employee has 10 days for whatever. If it's their child, it's fine. If it's them, but once you max that 10 days out, just to kind of keep it even, because we did have, we had 5 or 6, 7 people that did take it for their
Yeah.
child.
Okay.
So I think the other thing is this is not anything we budgeted. This is above and beyond.
Right, but pretty much all of this has been above
Yeah.
and beyond.
I was,
But we're electing to continue something that is not budgeted.
I was telling Nettie, I think the reality is this year we will be dipping into our fund balance, which we're in good shape, but we've had, our CARES Act money was gone darn near before the year started, and between Edgenuity and then all of the PPE stuff and this total cost, we're at almost $14,000 total cost for for paid sick leave, which is fine. I think we'll be able to. We're in good shape.
One caveat to remember though with those members is that now staff are not going to events either, so we're not
Yeah,
paying
that's
staff
true.
subs for staff coverage because they're going to learning events. So that
Like CSA.
offsets that to some degree.
Yeah.
Just keep that in mind.
So do we want to shift that second bullet, caring for child due to school, daycare, COVID-related closure, into covered?
Yeah.
I think so.
Yeah.
Are we saying closure or are we saying exclusion also?
I would probably say both, like due to exclusion or,
I would say both. I
Yeah.
just want to make sure it's not just closure of their school. It's if
Yeah.
their child can't go to school for any reason.
yeah. I can add the word exclusion in there.
All right, now then, I will entertain a motion.
I move to approve the new emergency pay leave and making it go back to January 1st and moving up the child exclusion or closure for their school to be covered.
Second.
Been properly moved and seconded that we approve extending the FFCRA leave. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. The next item of business is the approval of criteria for determining special education open enrollment.
Before we go into that, I just want to thank you guys, thank the board on behalf of the entire staff. Not all districts are doing this. There are many districts that have not extended that language, and I think it just speaks to how you guys are operating as a board, and I appreciate it. And I know the staff will appreciate it as well, because it has been it hasn't been easy. I mean, there are individuals in this list that have just been there's a couple that just have had a couple days that have been excluded, and then there are some that have been, I feel like, have been out again and again and again just because of bad luck, and what they've been dealing with family. So thank you.
Well, I want to make a note too, Josh, that you're the one that sheds the light on this stuff and leads us into making good decisions. So I
Sure.
hope the employees see that as well.
Thanks. Okay. Did you guys make a motion? I'm sorry.
Yes.
Yeah, okay.
Yep, and we seconded.
With that change.
Sounds good. Okay. So open enrollment, we do this every year. It's a little different this year just because of the COVID situation, where some districts have had to really think about, do they want to cap their open enrollment or not? We have historically not. Since I've been here, we have more open enroll going out, unfortunately, than we do have coming in. Need to slow down there. I highlighted the portion of the policy that speaks to, what we do as far as our criteria for individuals in open enrollment, but my recommendation is that we do not cap, that we keep doing what we're doing. we keep doing what we're doing. Yeah, that didn't make sense.
Keep on keeping on.
There you go.
So the highlighted portions then are added to the policy we've got already?
Nope, that's not a new policy. That's just our open enrollment policy, the decisions for criteria for the open enrollment. So we do not have we don't cap our special ed population, we don't cap our reg ed population. We allow open enrollment to come in. We base our special ed off of the DPI formula.
So if you could catch me up, Josh, why are we approving this?
Just because we legally, you guys legally have to every year. So Wisconsin
every year,
law requires it every January to look at your open enrollment and decide whether or not you're going to cap it. And if you do cap it, then you have to go through and identify what criteria you're capping at. My recommendation is that we do not cap the open enrollment.
So then I'll entertain a motion to approve the criteria for determining special education open enrollment.
I move to approve.
Second.
Been properly moved and seconded to approve determining special ed open enrollment. All in favor, signify by saying aye.
Aye.
All opposed? Motion passes. The next item of business is the verification of school board declaration and ballot placement.
Okay, so we got both Nettie and Christy running for school board again. And I want to thank you on behalf of the entire staff for running again and choosing to run again. And then we just have to identify who's going to be on the ballot first and who's going to be on the ballot second.
Thumb war.
We can't touch. How are we gonna do it anymore?
Good point, Christy. You could probably do a thumb
But we
work,
could
get
wrestle.
greased up real good with
So-
That might-
Without masks.
That may take 2 jugs of sanitizer.
Alright. There we go. Greg, pick a hand. This will be, the individual that you pick will be on the ballot first. Don't touch it.
Eeny, meeny, miny, moe.
This
Your
hand?
right hand.
Okay. All right, so on the ballot first will be Christy Kobernick. And Eddie Grote will be second on the ballot.
All right, after that difficult decision. The next item of business is consideration and approval of board policy 227101, starting college program now.
Okay, so we tabled these, both these policies last time. This is the old policy with the criteria. So my recommendation is that we just add this language to the new policy just to identify what the Clear Lake District identifies as a student in good standing.
Is this a universal definition of student in good standing?
I believe it was our local definition that we used for years before we had the new board policy. So just the section down below, 2/3 of the way down, that was like a locally determined criteria. I know it was in place when I first came here.
What's the grade point average to participate in athletics? I thought it was a 2.0.
It's not an average, is it?
It's not an average, it's no.
No, it's a-
Just
No
no Fs.
grades. 18 credits per pupil, is that state statute or is that our determination?
I think that's part of the language in the actual
Okay.
Start college now.
Because it says adopted in the state statute, the school district has adopted the following guidelines
Yeah.
in addition to the state statute, so that's why I was wondering where the 18.
I think that might be old language. That I think that might be superseded by the new.
I think so too.
I think the main thing was just the question about what's a student in good standing definition. I think was the language we were trying to pull that part 2/3 of the way down. How do we define student?
We can add that to it, yeah.
Yeah, I was just wondering about the credits, because sometimes we get an application that has so many credits in it.
So what we want to do is we want to put this into our policy manual then? Is that what we're asking to do?
So the request is to approve the two policies with the language for the beginning with for the purpose of the youth options. Obviously, we change it from the youth options, but the student in good standing, and then the A, B, C, D, and E. So new policies to include the student in good standing language.
Okay. No, that being said,
One question, my only question is, and I don't know how this plays out, Nick, you probably would, is March 1st long enough time to know how their classes are scheduled for the next year and what's available and how that's falling out? I mean, that seems pretty early to me with how I see when our girls get the scheduling.
It varies from year to year, but generally we've started the scheduling process by then.
And honestly, I don't think that's I think that's part of the, I know the dates are within the early college credit program.
It says right in the statute.
Yeah.
Okay.
Yeah, it aligns with higher education's scheduling of classes, is what it really aligns with.
I think too, I recall, like you were just saying, sometimes kids will put a laundry list of classes on there, so it's not necessarily I'm gonna take these, they're saying I'd like to be approved to take any of these. And then they end up picking, later on, which ones they actually do.
Okay.
okay. Any other questions? Okay, then I'll entertain a motion.
Move to approve the Start College Now youth options eligibility criteria.
Do I hear a second?
Second.
It's been properly moved and seconded to approve. All in favor, signify by saying aye.
Aye.
All opposed? Motion passes. We'll move on to consideration of board policy 2370, educational options provided by the district.
The same thing, just looking to include the student in good standing language in that as well.
So we're gonna use the same student in good standing language? in
Yep.
this Policy?
I will entertain a motion.
I move to approve.
A second.
Been properly moved and seconded to approve board policy 2370. All in favor signify by saying aye. All opposed? Motion passes. Now we'll move on to our superintendent notes.
I think I've talked enough, so I don't have anything to add.
Well then, that being said, we will, in accordance with WSS 1985, paragraph 1C, considering employment, compensation, or performance data of any public employee over which the government body has jurisdiction or exercises responsibility. Tonight, the board will talk about district administrator evaluation and review of employee performance. I will pull the board. Eddie?
Yes.
Skip?
Yes.
Ryan?
Yes.
Christie?
Yeah.
Myself, yes. Okay, everybody else, thanks for coming in. And
Guys, make sure that staff listing goes back to Josh so it gets shredded.
Are we in closed?
This?
yes, let's return to open session. I will entertain a motion.
I move to approve the district administrator's 2020-2021 evaluation.
Second.
It's been properly moved and seconded to approve the 2021 superintendent evaluation. recommendation. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. The next item of business is the future agendas item. Does anybody have anything they want to put on the future agendas item?
Probably just been policies.
I don't have anything else.
Will we be
right now.
close to the calendar being approved by then, do you think?
Yes, probably. So we have a calendar committee meeting. We're running a little behind this year, but calendar committee meeting on Thursday next week, I believe. So that will most likely that'll be on the next board agenda to be approved. The 2021-2022 calendar.
Vacation report was stated in open session. All right, anything else? Then I'll entertain a motion.
I'll move to adjourn.
Second?
It's been properly moved and seconded that we adjourn. All in favor signify by saying aye.
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 All opposed?